Welcome to OneTouch EMR, the #1 rated free EMR software in the industry. In this short demo, we're going to take you through the process of what to do once you receive your login credentials for your new EMR. You probably started out by going to OneTouchEMR.com and signing up for a free account. You should then have received an email confirmation asking you to verify your email address. Simply activate that, and a few moments later, you'll get an activation email with your login credentials. This is your customer URL. This is where you'll want to point your browser to and save it as a favorite. You're also given logon credentials for the first time, which is practice.admin and then a unique password. Simply copy and paste that password and click on the hyperlink, and it will take you to your home page. If it says anything up here other than your account number, then go back to your original email and copy and paste this URL into your browser. Once you're ready to log in, simply put in your username, which is practice.admin, and paste in the unique password that you were provided. And it may not allow you to copy and paste, in which case, just simply write it in, if that's the case. If at any point you ever forget your password, rather than going back to the main page and signing up for a new account, simply select Forget Logon, and whatever email address that you used to sign up for the free account is where you will receive your login credentials. Once you've entered your username and password, simply log in. And you'll be taken immediately to your dashboard. One of the very first things that I would recommend that you do is simply go here to Administration, Users, and notice that you have two initial users in here. One is your practice admin, one is your provider's role. While you can add new users, we recommend that you edit first the users that you currently have. Simply click on the user, enter your username or your first and last name. Everywhere where there is an asterisk, it is a required field, but in truth, it doesn't matter what you put in there. Make sure that you've got your email address in here. You'll notice that you've got your practice.admin, that's your username, and now would be a good time to change your password to something that's easier to remember. It must have at least one capital letter, and simply go down to the bottom and save it. You can then go to your provider role and put in the necessary information there as well. You can change your username. My recommendation is that you use your first initial, last name, and change your password. If you plan on signing up for e-prescription, for electronic prescriptions, make sure to include your NPI, your license number, and your DEA. A provider pin is something that you may select for yourself, and it will act as an electronic signature. Once you've completed that, simply hit save, and you may go back to your dashboard. The next thing that you should do is go to your setup wizard and configure your settings. You'll notice here under your setup, you have a dashboard of tutorials. You may request your setup for e-prescribing. If you're migrating from another system, you can import your data here. If you're migrating from Practice Fusion, you received instructions in a separate email from OneTouch EMR giving you guidance on what to do to migrate that data into the system. You can also request setups electronically for labs. You can select your templates from the template library. Simply hit Choose Templates. You'll notice that there are some generic templates already preloaded for you, both on the review of systems and the physical exam. These may or may not apply to your specialty. If they do not apply to your specialty, simply go to Install More Templates, where it will take you to our master database. And from there, you can select or view and select from the number of templates that we currently have. At about page 3, they start to break down by specialty, and they are alphabetized. If there's not a template in here for your specialty and you would like us to put that into the system for you, simply email that template to support@onetouchemr.com or contact sales@onetouchemr. And we'll be more than happy to get a template in there for you. If you're not sure what a specific template entails and you'd like to view it before you install it, simply hit View, and it will open up a preview of that template where you can see the various body systems, the exam elements, the observations, sub-elements, and so forth. All of the templates are 100% customizable. And once you've selected a template that you'd like to work with, just simply hit Install. And it will take you back to your templates. If you're loaded in as the practice admin, make certain that this box is checked so that it may be shared with all of the other providers in the office. And you may also preload a specific template into each of your notes by simply hitting or checking this box, Load by Default. Under your practice settings, you can set up your instant notifications. Under your practice profile, you can put the name of your practice, any descriptor. You can select a unique specialty, and in doing so, what will happen is it will feed through the RSS feed on your dashboard industry information specific to your specialty. Select what types of payment you accept. If you have a practice logo, you may upload that image here. Just simply select the file from your desktop and load it here. Under your practice location, you'll see you've got one initial location available to you. Simply click on that and update the information as appropriate. make sure to include your hours of operation and save it. Appointments. You have default appointments that are set there, but depending upon your specialty, you may want to modify, change, add, or delete these appointment types. To delete, it's as easy as just selecting that and then deactivate the selected. When you add a new appointment type, it'll open up a dialog box, and you can select or write in what you would like to put in there, perhaps like a follow-up. If you'd like to have it specifically color-coded on your calendar, you can select from the colors. Provide it with a default duration. The encounter types. Currently, you have 2 default encounter types: default and phone. An encounter type is simply your workflow when you're building out a note. And so when you look at the default, you will see a complete note and all of the elements involved when working with a patient. This note structure is ideal when you're visiting with a patient for the very first time. You can see here that you can show or hide specific headings and settings. You may also change the name of the tabs. You may also change the order of the tabs simply by dragging and dropping it. Once you have set up your encounter type the way that you would like, simply go back to your appointments and associate that template, that workflow template, with your encounter type. Doing so will ensure that that specific workflow template will pre-populate when the appropriate appointment type is scheduled for a patient. This will maximize your workflow. For example, again, the first visit with a patient, you're going to want to collect as much data as possible, and so you're more than likely going to use a full encounter type. But for a follow-up, also for the title for the summary, this is exactly what will print across the top of your note as well as your patient summary. So in this particular instance, for a follow-up visit, maybe I don't need the chief complaint. I may need the HPI. I may not need the history or their meds and allergies, but I'll go ahead and keep their meds and allergies. I don't need the review of systems. I don't need the vitals. I don't need a physical exam. I may need a point of care. I do not need my results for labs. I may need to keep my assessment so that I can update any prior diagnosis. My plan section will allow me to add any medications or order any additional labs, and of course my super bill. And I will simply go ahead and add that to the mix. I can then go back to my appointments, create a follow-up, duration of 15 minutes, and simply select that encounter type and add it. If your practice has various rooms for examination or triage, you can simply come here and update the information or add or delete certain information. You can also change the status, and you can also create reminders for text and email for your patients when they schedule appointments. If you need to add some custom fields to your patient records, you can do that here. We've discussed encounters. Your letter templates would be doctor's notes. Patient can't go back to work for 3 days. Please excuse this child from school, and so forth. You have an integrated patient portal inside the EMR. If you'd like to know what that patient portal address is, simply go back to your initial email, your welcome email from OneTouch, and at the bottom, you'll find the link to your patient portal. Our recommendation is, if you have a website already for your practice, simply have your webmaster create a button for patient portal or forms and link this address to that button. That way, each time your patient goes to your website and they can select check-in or patient forms, and it will direct them to the OneTouch patient portal. Once you've completed the initial setup wizard, you're ready to begin charting. One of the things that you can do individually is select your preferences, which will create favorites or system settings to the individual. Practice admins are the only one that see this tab. Everything under the administration tab impacts and sets up the practice as a whole. Each user will see a preferences tab, which allows them to create settings for themselves individually. For example, under the preferences system settings, you'll be immediately taken to your account, where you can update your information, including putting in your private provider PIN, which this can be a 4 or 5 digit number that is unique to you. And again, it allows you to sign off electronically on your notes. You also have the opportunity of uploading a signature image that will automatically print on your note, on your prescriptions, everywhere where a signature is required. It will automatically save that signature and put that for you on it automatically. You may also update your information, your email, your work cell phone number, your default location if you happen to have multiple locations. And here you can also change your password. Once you've got the information in here set up the way that you'd like, simply hit save. Or in this case, I'm just going to cancel. Again, what it's looking for is everywhere where there's an asterisk, it's a required field. You may also change your display settings, so the color, orientation, your text elements. This is really just more of customization based on personal styles and preferences. Favorites lists are where you'll find things like common complaints. You can build macros for the HPI that will streamline your processes. For example, when you hit Add New, and when I'm seeing a patient today, I may say, what brings you in? What seems to be the trouble? And they say, I have a cough. Well, what's the location of the cough? Chest. Left lung, wherever it may be. The quality of it. Is it productive? Dry cough. Context. And if you want to know what it means by that, where the patient is and what the patient does when the symptoms begin. Outside, indoors, the modifying factors, what makes the symptoms better or worse, running, smoking, the associative signs and symptoms and so forth. Once you have that set up the way that you'd like, simply hit save, and you then can employ this macro during an HPI. You can also create your favorite medical diagnoses. You'll notice once you hit Save New, it'll open up a dialog box. You can put in the diagnosis that you want, and then a drop-down will come based on whatever it is that you're looking for. For example, I've typed in influenza, and as you can see, there's a number of different selections that we have here. Rather than have to search for this on the fly, if I automatically know what it is that I'm looking for, I can simply select it and save it as a favorite. Now, you may look up by the name of the condition, or if you happen to know the code, you can put in the J code as well. I'm going to select this and save it as a favorite. You may do the same thing for medical history, surgical histories, macros. Most of you should be familiar with macros. And all a macro is, it is a shortcut for you to be able to add a significant amount of text without having to type or dictate that out in the node. There's no limit to the number of macros that you can have, and you can use them for a number of different things. And so, for example, I'm going to put a macro in here, give it a shortcut name that you know what exactly it is that you want to put in there. And from here, you can either type or you can copy and paste. If you have a large amount of text, you may copy and paste that into the macro. Once you've got that set up, simply hit Save. You can customize your encounter plans, and within your HPI, depending upon your specialty, you may want to change the item titles. Doing so is simple. Just go to the Encounter HPI, select on the appropriate title, and change the name to whatever you'd like it to be, and then hit Save. Also, under your Preferences list is another area where you can go back to our main or our master template library. Again, it defaults to whatever is currently in the system. If you'd like to add, install, and customize any additional templates, just simply hit Install More Templates. The individual work schedule. This is you as an individual or as a physician where you would put or create your work schedule. Doing so will enable or disable patients and your front office staff from being able to schedule you at a time when you're not in the facility or you're at a different facility. And you can simply, for example, if you're at multiple facilities during the week, you can select from the location, select whether or not it is a work location, and the days and times that you're at that specific location. You can then either save that location as the default, and if it's just the main location, just simply hit Save. You're then set up. That is everything that you need to begin charting. Everything else can be customized under the Administration tab, which we'll talk about very, very quickly. So under the Administration tab, we've discussed users, we've discussed setting things up. Now let's talk very quickly about directories. Your directories is where you can create and add additional lab facilities. So if you work with any local diagnostics labs or x-ray labs, you can put those in here. If you have a private list of pharmacies that you'd like to incorporate and add here, you can simply choose pharmacies. You can add individually by simply hitting Add New and completing the information. Or, if you prefer, you can download a template, and if you have that information in an Excel spreadsheet perhaps, you can copy and paste it to the appropriate columns within the template that we provide to you, and then import that information back into the system. If you work with a referring physician, you're going to put this again under Administration Directories, your referral list. You can add individual physicians, or again, you can download our template, copy and paste in the appropriate column, and import that back into the system. Your point of care items are specifically where you can create and customize things that you do within the confines of your practice. For example, if you do any labs internally, this is where you can create, add, update, modify those tests. Same thing with radiology, procedures, and adding a new procedure. As you see here, you'll have a dialog name. The procedure name can be whatever it's going to be. Removal. You can give it a category, and you may customize the category simply by hitting Edit and then adding whatever category you'd like it to be. The reason is going to be the diagnosis code. And again, as you start typing in whatever it's going to be, the various diagnosis codes will pop up, and you can select it for that specific procedure, or you can leave it blank and take care of that while you're actually in the note. If you'd like to insert a form, you may do that here. A form could be a questionnaire, or it could be a test protocol. For example, if you're a vascular group, you may do Doppler studies, and we have several groups that will insert Doppler study checklists for their technicians. And we'll talk about inserting forms in a different tutorial. If you'd like to put some static or procedure notes already in the procedure, feel free to do that here, and then complete the rest as appropriate. Any CPT code, any modifiers, any associated fees related to this particular procedure is going to show up on the super bill. And so you want to make certain that you've got this information filled out correctly. Any immunizations, injections that you may do inside the practice, any meds that you may administer inside the practice, or any supplies that you may administer inside the practice that, again, have associated costs that are reimbursable through insurance or by your patient pay. Under our health maintenance plans, you're already going to see some preloaded maintenance for various things like asthma, back problems. These are programs that are, again, customizable and have protocols attached to them for your patients. You can set up clinical alerts as well as patient reminders and your setup details, so that when you send out those reminders, patients know what to know or what you need them to know. Under your forms section, there are two types of forms. There are printable forms and online forms. Printable forms could be anything that you have in-house that does not really require a signature. It's just a PDF file. Could be a HIPAA form, a consent to treat, promise to pay, those types of things. What you may do is go ahead, if you already have a clean copy of whatever form you'd like to upload, simply hit Add New, put in the name of the document, any description if you so prefer, and you may either drag or drop the form here or select it from your desktop or some other location. You can then select whether or not this is going to be a clinical form, a non-clinical form, or if it's a patient form to be seen by the patient inside the patient portal. Once you've got that collected and set up the way that you'd like it, simply hit Save, and you're good. Online forms are available, and they can be done very, very easily. So if you would like to add a new form, again, give it a template name. So like a customer sign-up, checklist, could be a health questionnaire. And again, what it's asking here is who can access this form. Is this a clinical staff form, non-clinical, or is this something that the patients are going to complete for you? And if this box is checked, this form is going to be available to the patients through their patient portal. Then proceed to the forms builder. You can simply watch a tutorial on the forms. If you need more information about building forms, reach out to OneTouch support and ask them for the video tutorial. Or you can also come up here to the help section to the tutorial library and watch one there. Once you've got the form set up the way that you'd like it, simply hit Publish and save the template. And that concludes setup inside OneTouch. We welcome you and look forward to hearing your feedback. Thanks again for using OneTouch.